My name is Ty Ross. I live on the Texas, New Mexico, and Mexico border. I'm technically in New Mexico. Um, I'm from El Paso, Texas. I have also lived in Dallas. I'm a mom of four, a single mom. I'm 47 years old. And out of my four children, I've been pregnant 10 times. My body doesn't always agree with what's going on inside of it. After my first pregnancy, 2000, things were pretty normal. I was 26. I didn't have any issues. I was pretty active, literally until the day that I went into birth. I gave birth. Um, I was in labor about 24 hours. That was the most difficult part. About a year later, I started to have that same feeling that I got when I was pregnant with my first child, a little bit of nausea. I immediately got a pregnancy test. It was negative, but I thought maybe I just need a little more time. I was having a pain on the left side of my body, and the internet was still kind of new, but I poked around a little bit and I would read about ectopic pregnancies and the symptoms, but I didn't want to jump to conclusions. And then I started spotting a little bit and took myself to the emergency room. I went in the emergency room and I was talking to the intake people and the patients. And I remember asking them for a sonogram because I was convinced that the child was in my tube. So I was waiting for hours and they gave me other tests. They did everything but give me a sonogram and told me that everything was fine, that was nothing to worry about. And literally, as right after I got dressed and they were discharging me, it ruptured. And it was like a blur from that point. All of a sudden, I was being undressed. I was being put in a gown on a gurney. I was being wheeled in. They had, the IV dripped and everything hooked up to me to prep me for surgery. And at that point, I also found out I was allergic to morphine. So in the midst of all that, they go whisper in my ear, "You're allergic to morphine," if anyone ever asks you that. And they immediately counter with a drug to counter that. Next thing I know, I was waking up and I was in pain from my abdominal area to my vaginal area. A doctor came in and proceeded to tell me what happened in the process, that it had ruptured in my tube. I had to have an emergency D&C. They didn't want to remove the tube completely because I was only 27. So the doctor burned off the half where it had ruptured because you're prone to have another ectopic pregnancy. And I remember thinking, if they had just listened to me and given me the sonogram when I asked for it, they would have seen that a baby was not in the uterus and could have avoided all that. So I was a bit angry and then also grateful that I hadn't left the hospital because I was on my way out. And in the amount of time that it happened, I would have been on the road and I would have been driving. When that happened, they called my emergency contact, which was my best friend at the time because I didn't have family in Dallas. They were all back in North Carolina. And then, after that, I had checkups, but I was always like really wary. I wanted more children, but, I was also a little bit scared. And then I continued to have miscarriages over the next few years. I would be carrying a baby and I would get that feeling of nausea, and then, things would happen. After my second child, there were complications. She was born a month early and I had to go into emergency surgery with her. That was the next year after the ectopic. And then a few years down the road, I got pregnant with my son, Christopher. And about 3 months in, I was having a lot of pain. I was at a restaurant. I remember going to the bathroom and just literally leaking blood and tissue. You could feel a bucket. I didn't know what was going on. It was one of the scariest moments of my life. And I went to the hospital and the doctor said that there was no way that the child could still be alive with the amount of blood and tissue that I lost. But for whatever reason, just call it instinct, I didn't want them to do an abortion, which was suggested, which was my choice. And thankfully, Christopher was born alive, but he was born early and he couldn't breathe on his own. So he was in NICU for 6 weeks. They had to have him hooked up to a breathing machine. I myself was in the hospital because I had preeclampsia. Um, so that was pretty rough. After that, I thought, this is it. I'm not going to have any more children after that. But I did notice the difference in the care that I got when I was pregnant with Christopher versus when I was pregnant years prior, because um, he's 12, there's 6 years between him and my middle daughter, Victoria. And that before I had full on prenatal care. And then because I had Medicaid then, and with Christopher, I had Medicaid, but they cut so many services. They weren't doing the testing that they were doing before. I was no longer seeing a doctor, but a nurse practitioner. Um, when no doctor came in, I never did get to see a doctor, and most of my appointments were handled by just nursing staff. I think I saw the nurse practitioner once or twice during my entire pregnancy. So I did notice, those little bit of changes, but I didn't think much of it at the time. Few more miscarriages in between, and then I got pregnant with my youngest and my last, Jeremy. My pregnancy with him, about a month in, I was dilated to the point where I would be if I was to give birth. So I was on bed rest for about 7 months, and I had to get shots every week to prevent me from going into labor. I found out at the time that I was a carrier for spinal muscular atrophy, which is one of the worst cases of muscular dystrophy. And awaiting that was testing they didn't have before with my other children. So just with technology, I had no idea. But I had to go into emergency surgery when I did end up giving birth. I didn't get my shot 1 week, and I immediately went into labor. The aftercare that I received wasn't the best. Being on Medicaid, I also noticed children used to be covered for up to a year, and it would include postnatal care for them, as well as myself, and all of those things had been cut as well. So I was also told by the doctors that if I had any more children, I had a 50% chance of dying. I did want to have more. I didn't really register in my brain, but the more that things started to come out and I started reading about the maternal mortality rate and infant mortality rates among African-American women and their children, and standard of care, even for someone like Beyonce and Serena Williams, it began to sink in that, number one, I was lucky to be alive. I'm thankful to be alive. And number two, that even if my body was able to carry a child, I may not get the care that I needed to be around to raise that child. And as someone who has a daughter of childbearing age, it's something that I worry about and I think about. I don't want to tell my 21-year-old not to have kids, but at the same time, I'm worried about what is going, if she were to get pregnant, what would happen? Is she going to get the standard of care that she needs? I was married to a doctor for a long time, so I knew what questions to ask the doctors. I knew that the things that I asked them were appropriate and correct, and yet they still didn't listen to me at times, and it could have cost me my life. There definitely needs to be more communication between doctors and patients. Even a woman that doesn't have any experience, we know our bodies, we know when something isn't right. And when we're not listened to, especially African-American women, it's detrimental, not just to their health, but putting them in a position to leave their kids orphans. And my experience encompasses all things. I'm on birth control because I have to be. And I can't take certain birth controls because my body rejects them. I can't do the IUD. I can't get long-term like Depo-Provera. My body reacts adversely to it. So I have to take the pill, one, to regulate me, and two, just to be hormonally normal and balanced in a reproductively healthy way. So when I see these legislation being introduced to reimplant a tubal pregnancy or to ban or restrict access to reproductive health care and choice like birth control, it puts me at 47 and also being getting older in an extremely vulnerable position, and women like myself who really don't have the option of being able to carry, you know, another child to term for both the mother and the infant's sake. So, you know, I definitely would like to see it being taken more seriously in Congress and the legislature. And instead of having politicians talk about it, having doctors talking about it, because, and women who have experienced it, because we're the ones who know, we're the ones that have to go through it. And I think having, it's not just people on Medicaid, but having people that have been dismissed by doctors who have comprehensive medical insurance, who are considered educated and middle to upper middle class, that it's something that is unique and common across the spectrum. It shouldn't be, but it is. So it's something that we definitely need to pay more attention to and take a look at. That's my story.